minutes of our previous meeting, which you should all have. Are there any issues to do with those minutes, please? No? Well then, could I please have a proposer and seconder that they be adopted? Thank you, Joel. And the seconder, please. Thank you, Amy. All those in favour? Thank you. So we'll move straight on to item 3 first, which is the report from Rachel, our Director of Public Health. Thank you, Rachel.
Good morning, everyone. Nice to see you again. Obviously, I think it's been some time since we last met, and things change rapidly in respect to how the pandemic is progressing. And you will all be aware that we are now sort of in the phase of living with COVID, which I like to say living safely with COVID, because we are in the stage in the pandemic where many of the restrictions that we've had, particularly around self-isolation, and have been removed. So as of the 24th of February, there were some changes in national guidance. What we've been doing, both in the Isles of Scilly and Cornwall, is to try and ensure that this message about personal responsibility continues to be clear, continue to give information to people through our communications, and support people to still access testing. Things are rapidly now changing from the 1st of April, and there will still be some changes which I'll share with you, but just the current position in respect to infections in the Isles of Scilly. So daily, as I say, things change, but you have had a higher rate of infections that have been confirmed through testing, up to around, I think, 56 in the previous 7 days. This is now starting to come down. So the next 7 days, around 22 cases being detected. So clearly has been some reduction in the number of people testing positive, which we hope continues. But clearly, as these restrictions and the messaging nationally has changed, there has been change in behaviour, and very small changes in behaviour we've seen across the country has led to increase in cases. What we're not seeing, as you will have heard nationally, is people becoming very unwell. So the vaccine coverage has been hugely protective. They continue to be effective. There hasn't been, in spite of these numbers of cases, very severe illness. Although in RCHT in Truro there are increasing number of people in hospital, and also people who have come in with COVID but aren't necessarily unwell with COVID. So there's a picture which is high rates of cases everywhere, so people are likely to bump into it. Increasing number of people as a result who are in hospital, either just with it as they've been in, or having some illnesses that need some treatment. But what we're encouraging is this continued uptake of the booster vaccinations, as there is some now evidence around the waning of immunity from people who would have had their last booster sort of 6 months ago. So important that people take up that offer of the booster. What we're seeing in the Isles of Scilly in terms of the support from the public health team, we know that the school is feeling well supported, because clearly that's been an area where there have been infections. Our public health team supports any outbreaks on the Scillies as a vulnerable setting, so very much prioritised, and we will continue to do that, particularly with support for your care home. And incident response can be set up as and when. So we will, as a public health team, maintain that support in terms of our specialist outbreak support. And we're working very well with the GP and in terms of communicating the messages around sort of responsibility and understanding that hands, face, space and fresh air still are the main reasons and ways in which that we can reduce our infection. But I'm aware that the people are concerned about being infected, particularly having been protected as a community, but also people who are vulnerable. And clearly, getting the vaccine remains the most effective way to do that. Now, I will just finish by talking about the testing changes. So until now, there has been availability of lateral flow tests in the community. There has been a priority on testing, and there are a number of changes from tomorrow, which will mean that the community testing will end. So this availability of testing for the general population is going to change to be very prioritised at the most vulnerable. So NHS, social care and other settings that are related to care and support, but we are still awaiting the specific announcement about how that will be exactly delivered. But it is it's very likely that people may be concerned, because that's the usual way in people using rapid tests to see if they are positive. That is being ramped down, and we are beginning to live with this virus like it is other viruses that clearly we don't always test for. So very much prioritising people in provision of care and NHS settings and staff. So that will continue, but other people, unless they're symptomatic, will be unlikely to be able to get them for free, but there will be other routes. So more information will be announced around that testing strategy. It hasn't yet been released from the government, and we'll be able to share that with the community and give clear communications about what's happening next. So unfortunately, a bit late in the day to be able to give that exact outline of how that will work, but we do know that the free testing will be restricted to those that are most in need of protecting. So happy to take any questions on those points, but clearly...
Sorry, Rachel. My husband got a pack of free tests from the National Health yesterday because he's clinically vulnerable. I just wondered if that's the norm on the island. He got sent 7 tests at the moment he's on some treatment that makes him clinically vulnerable. So I'm guessing people are getting them, aren't they, in the post?
That's right. I understand that there's both a PCR test kit and then a lateral flow kit of 7, but it seems to be a bit variable, so I'm not exactly clear. I haven't been told how this is happening, but clearly that's the priority is to be having those tests available. So if someone did have symptoms, they could take the PCR test, and then the GP would be informed if it was positive. And now there's treatments through both antiviral treatments and antibody treatments for people who are vulnerable and become unwell. And that's clearly another protection, is that the pathways are in place to give these early drugs to people who might become seriously unwell.
I haven't opened it yet, but I think there's a pack of 7, as you said. Yeah. Okay. Yeah. There we are.
Thank you, Anita. Any other questions for Rachel, please? No? Well, thank you, Rachel, very much indeed for your update. We'll now move on to item 2 on our agenda. Aisling, if you'd like to take that one, please.
Yeah, I mean, to be perfectly frank, Rachel and myself and Abby have had a catch-up, so I haven't got a huge amount to add to the clear picture that Rachel's given. We are very aware of how the community does, feel a bit vulnerable at this point of transition, and we recognise that, but we're obviously following national guidance and we'll keep promoting personal responsibility. As you know, we have really good access to vaccines, so Health Centre are on the case with the boosters, and we'll be doing some really good communication messages across the community. But yeah, as you know, as an employer, we do encourage and support through our own policies that people who don't feel well shouldn't come to work. And that's basically the point. And I think if other employers could follow that practice, that would be really helpful. But I haven't got a significant amount to add at this stage.
No, I understand. Thank you very much, Aisling. Anita, you wanted to come in again?
Just, I heard informally that there is actually clients with COVID at Park House at the moment. Is that correct?
I wouldn't confirm that in the setting just because of identification. Right. As you know, Park House continue to have robust infection control procedures for a variety of illnesses, and those have been implemented.
Okay, thank you.
Okay, thank you. Fran?
Thank you. Good morning, everyone. Would you suggest, Rachel, that the council continue to regularly post communication about the hand-face-based ventilation message on a regular basis ongoing now?
Thank you. I mean, I think there's been some regular comms that have been, I think, agreed with myself and across the local authority members that is on your website. And I think that if there's any change, that certainly we'll update that so it's very clear. But I think we have been continuing to do that, to use those simple messages because they seem to have stuck. It would seem sensible. They do work. That's what people are using, and they are very effective. If you're the person who's in an area, you can just assume that you will be bumping into the infection, and so all of those things will be effective. So yes, agree that we should be using those simple hand space-based fresh air messages to keep people aware.
Thank you. I don't think we've got anyone from the harbour here, have we? We sometimes have Dale, but I don't see him on my screen unless he's hiding somewhere. It's just that we did discuss in depth when things were a bit trickier, that one of the best things we could do was have a message when people actually arrive, because there is this unfortunate thought from some of our visitors, and that may possibly carry on, that they're coming on holiday, they're now in relaxed mode, and they don't have to worry. And I think, possibly revisiting the conversation around having a simple message as people get off the boat and at the airport, which will hopefully be reinforced by the steamship company's sensible policy of, I believe they're still asking for masks. I'm just wondering if that might be an idea to still have that in the frame. Obviously, we've got Tom on the call, so that will be useful. Thank you.
Okay. Thank you very much. Thank you, Fran. Right, well, with that, we'll move on to communications, item 4 on our agenda. Thank you, Aisling, for your as well. Tom, are you able to take this item, please?
Thank you, Chairman. Yeah, I'm happy to take the item. The picture isn't that much different to what Rachel and Aisling have described. Rachel's absolutely right. The last sort of localised update we put out was on the 14th of March. That was from our public health team specifically, and it reflected the messages Councillor Grotto was talking about there. So just reinforcing the basics. So whilst all of the freedoms, for the most part, have returned, all of the preventative measures are still effective. So we would absolutely encourage anyone, particularly if they're concerned about getting COVID, to follow all of those steps of guidance. The problem we have in being too robust on this is that the guidance has relaxed and the laws are not in place that were once in place, so we can't insist on things being the case. So we would encourage each employer to make decisions based on however they feel is best to proceed, but we couldn't insist on it. As Ashley mentioned, the council has policies in terms of sickness in relation to COVID, but that will vary from employer to employer. We'll keep sharing social media messaging from the Department of Health and Social Care. They put out very regular messaging on COVID. They still promote the really important messages of letting fresh air into spaces, using face masks if you feel necessary. So we will continue to push those. And obviously, if anything changes, we'll change our approach to comms and escalate as necessary. So that's the approach at present. And there isn't really anything additional I can add at the moment, other than obviously we need to reflect the new testing rules that come into place from 1st of April.
Okay, Tom, thank you very much indeed for that, which is all very clear and useful. John, you've got your hand up, please.
Yeah, thank you. Just wondering, for those that are likely to require a fourth booster within the community, will they be notified, or is it down to them to inquire as to when they can get it?
Thank you, Rachel.
Thank you. Yes, the practice will contact anyone who's eligible, and they will be delivering, as previously, the boosters in order of priority. So it is really wait to be contacted. But certainly, I know on the Arthur City, there's been a very good take up the vaccine programme seems to work effectively. So do hold on, and I would expect you to be invited in order. But it is, at the moment, it'd be over 75 as a priority group.
Thank you, Chairman. It's interesting, and I don't want to make it personal. It's not for me, but as an example, my mother is 91, and she hasn't been contacted yet, so that's why I inquired in part.
Yeah, they're not. I don't think they're in circulation just yet, John. But as soon as they are, I saw a communication from the health centre saying that they're a priority area, and we should all know within the next month or so when the programme starts. So don't worry.
No, thank you. Not worrying. But
good.
Rachel said that the take-up was good for the 75s and over. That perhaps isn't quite right yet. Is that?
No, I think take up of the original vaccination programme, but now as the boosters come in, we'll make sure that they get delivered rapidly, like they have, every time in the past.
Fantastic.
Great.
Thank you. Joel?
Yeah, could I just clarify that things we had previously, like the evacuation fund, that's now concluded? If someone comes here on holiday and falls ill, it's up to them to get themselves repatriated, is that correct?
Yes, that's our understanding.
Yeah, I think, Joel, from the chair, I was discussing this with Rachel earlier. I mean, I think the council's stance is that that has come to an end now, because we're not getting the same level of sickness that we were faced with last year. The hospitalisations and so on, but it's constantly under review. Excuse me, Joel. And obviously, if it needs to be stood up again, then I'm sure it will be. Tom, you wanted to come in on this, please?
Yeah, it's just a quick point on repatriation. You wouldn't technically need to be sort of repatriated because the isolation rules aren't in place, so it would be a personal choice under those circumstances. That's my understanding, Rachel. Is that correct?
Yeah, if you could just comment, Rachel. Sorry, because other
Yes,
people
sorry,
can't see.
my mute button. Yes, that is. There's no legal requirement to isolate, so that's right.
Okay. Thank you. Are you happy with that, Joel?
I am, yes, yeah, thank you.
Okay, thank you very much. Any more questions for Tom, please? Okay, Tom, you've got your hand up. Did you want to say something more?
No, sorry, Chairman, that's a latent hand.
Okay, thank you. Well, from the chair, I'd just like to reiterate that I believe our stance from the council is that we still need to be careful, even though everything's opened up, so that we're protecting our vulnerable people and our elderly people, so that, we still take the message of hands, face, space and ventilation. And I think we should support all those businesses on Scilly that are still trying to be careful, even though the regulations have been dropped, the shops, our transport carriers and so on, and we should just try and promote the message that we want to keep Scilly safe and all our residents and visitors safe. But we fully understand as well that life has to go on, and we have to look after all those people who have other health issues as well, and try and manage it all in the round in the best way that we can. Now, we have got government guidance that these local outbreak engagement boards that we have in Cornwall and we have here and in other councils should now be stood down as such, and not convened on a regular basis anymore. However, with the proviso that if we have any further serious issues, such as another strain that is more dangerous or whatever, and we've got cause for concern, that we actually stand the board up again. So that is what we are supposed to be doing now. So could I please have a proposer and a seconder that we stand this board down at the moment, and that we would reconvene it if the need was so required. So I have a proposer and a seconder, please.
Happy to propose, Chair.
Yeah, thank you, Councillor Grottick. Can I have a seconder? John May. Thank you, John. All those in favour? That's carried. So thank you very much, and thank you everybody for your attendance today. Thank you.
Thank you, Chairman.
Thank you.
You're welcome.
Close the meeting. Thank you.